sort of brought it up, and that's one of the things that we really try to focus on a lot in the programs that we deliver here. Is the clinical reasoning side of it, because you can go on YouTube and you can see a lot of these Mulligan techniques, and that's good. We support that, and there's a lot of people teaching it, and that again, that's been incorporated now into our Canadian orthopedic manual therapy system, and we're very happy that that's the case. But the problem is for us, or the concern we have, is that what's not been incorporated yet, or what you don't get, is the clinical reasoning side of things. Seeing a technique being done on YouTube, being taught a technique just as a standalone technique in a course is great, but do you really understand how to use that? So again, the analogy I use is you can go to the driving range and learn how to hit that golf ball with your driver, and you can just hit that ball as straight as an arrow, and you can hit it really, really far. But do you know how to play golf? Do you know that the idea is not to hit the ball far? The idea is to put the ball in the hole. And so I think that learning the skill of how to hit the ball is really good. And that's important. And those psychomotor skills is what you get by going to an in-person course delivered by a accredited Mulligan teacher. But again, the thing that I'm going to speak to for a few moments, if you don't mind, is some of the clinical reasoning that supports that. And again, I use a lot of analogies because I like them. They kind of work for me because I think I'm kind of a simple guy. And so this is how I think. So I use this analogy a fair bit. And so you're cooking spaghetti, and it's there in the pot and it's boiling away, and you're getting hungry and you think, gee, I'm really hungry. I got to eat this dinner. And so you think, oh, the spaghetti must be cooked. And so you dump the spaghetti out of the pot and the water, you dump it into the colander, and you rinse it off, and you grab one of the strands of spaghetti, and the old-fashioned way of doing it is you throw it on the wall and see if it sticks. And that's how you tell if spaghetti's cooked. You throw it on the wall. If it sticks, it's cooked, right? But what if you throw it on the wall and it doesn't stick? Well, what you got to do now is you got to get the water back in the pot. You got to get it boiling again. You got to put the spaghetti back in the boiling water. You got to cook it some more. And so that's retroactive response, isn't it? You don't know until you have done the thing and then go back and retest it to see whether or not it's worked. And with tremendous respect, and again, it's not one system is right or wrong. The traditional orthopedic manual therapy system, built on Jeff Maitland's work from Australia, follows exactly that principle because it follows a test, treat, retest paradigm. And so it's reactive clinical reasoning. So the patient can't turn their neck to the right. You lay the patient down, you do this stuff to them, then you sit them back up, and gee, they still can't turn their neck to the right. Or they can. So again, you don't know if what you just did has been a benefit to the patient until you get the patient back up and do your retest with that system. So Mulligan, to my mind, and I think this is the key here. This is what really gets me excited. What Brian Mulligan, I think, gave me was a long-handled pasta lifter. And I get to reach into the boiling water with that pasta lifter without getting my hands burned. I get to pull out a strand of spaghetti, and I get to throw it on the wall, and it doesn't stick. And you know what? I keep the water boiling, I keep the rest of the spaghetti in the pot, and then I can retest it later on. And now if I pull it out and it sticks, well, hey, spaghetti's cooked, and now I can dump it out and serve it. And so that is not so much as reactive clinical reasoning as it is real-time clinical reasoning. Because now we've moved from a test, treat, retest paradigm to a test, treat, retest paradigm. So I know that I'm in the right place, doing the right mobilization, in the right direction, with the right grade while I'm doing it. How? Symptom response.